Hello, my name is Janet Fleischman. I'm a senior associate with the CSIS Global Health Policy Center, and it is my honor to be here today with Dr. Awa Marie Coll-Seck, the Minister of Health of Senegal. Welcome, Madam Minister.
Thank you.
You have spoken eloquently as a mother, as a medical doctor, as a minister, about the importance of family planning for Senegal, both for health and development goals. Can you tell us why family planning is so important for Senegal?
In Senegal, we have seen population grow with a lot of young people being the majority of this growth. And they are unemployed, a lot of them, and they don't have really access to human services. This is the first thing we are looking at and say, if we continue like that, to have almost more than 60% of the population being young people, it will be very difficult to have an economic growth in Senegal. But the more important is that we know the link between family planning and maternal mortality. We know that in all countries where the prevalence of contraception has grown and the number per person of child has decreased, this is a factor of development. It is why we consider in Senegal that family planning is really key for the development of our country. This is why we have put it very central in our plan, the National Plan on Health and Development, but also in what we call the Plan Sénégal Émergent, which is a long-term plan for Senegal for economic growth, where we have also centered the human capital with education and health, and with family planning part of the health program.
What is the importance of the public-private partnerships that Senegal has introduced in support of family planning?
The government of Senegal has set objectives, have elaborated a program, a plan for family planning, but for the operation, the government can do a lot, but cannot do all. We have private sector services. We cannot just think that it's only the public sector, but also we know that with the private sector, we can go faster, and we have learned a lot on efficiency of the private sector, and we have used the private sector to support family health program in Senegal. And I can give the example of the push model, which is a way to have contraceptive very far in villages or in suburban area where normally nobody is going. And this has been done through the private sector. If we look at private sector, where we have also NGOs and associations all together, they have been able to do that and decrease a lot the shortage of contraceptives. This is an example, but you can have a lot of examples. It is why in our plan of family planning, we are really promoting public-private partnership, because we think that it's the best way to have results.
And Senegal has had some extraordinary results recently, showing that there are great opportunities ahead, but also considerable challenges to maintain the progress. Can you speak for a minute about what you see as the main opportunities and what are the big challenges that you have to address?
a strong partnership with all partners working on family planning, particularly USAID, the Gates Foundation, UNFPA, but also another foundation like Willett Foundation. But we have also partners who are the agencies working for these big donors, like IntraHealth, ADEMAS, but also World Vision, Child Fund. A lot of groups associate, but we have also WHO and UNICEF supporting us technically. All these are working together in supporting our plan. For me, this is the main opportunity we have in Senegal. We have also as opportunity the leadership in Senegal, where the head of state himself, President Macky Sall, is one of our champions for family planning, and is always asking me if we cannot do more and quicker, because it considers that this can help a lot also for the development of the country. And we like to speak of democratic dividend, etc. And I think that this is also something important. In some countries, you have no support and from the leadership, and this is also one of the real challenge. But in Senegal, we have at least these two, partnership and leadership. As the challenges, it seems to me that we need to really highlight the fact that we need to have mechanism to have more fund coming from the country itself, to avoid to be dependent of the donors, and to have our own money in the family planning. And we are working particularly with the Minister of Finance on innovating financing to be able really to have a good contribution for the sustainability of the programs. The other challenge I see is the religious leaders. We have a lot of religious leaders accompanying us in this fight, because we want this family planning for the women, for them to be empowered, for them to don't have to die by giving birth. All this they understand and they are very supportive. But you have others which are not supportive but very vocal, sometimes aggressive. So this is a challenge. We know it, but we will use those who are convinced to be able to really ensure that the message is well understood. Maybe a third challenge is adolescent. We are not doing enough for them because when for years the family planning programs has not moved. And when we have started to move, we coming from 12% of coverage 2 years ago to 20% of coverage this year in 2004. 2014, we just to consider that we need to involve more young people, adolescents. They are the future of our countries, and we need to look at means and way to approach them, discuss with them, and give them access to the services. So these are almost challenges I am seeing.
Mm-hmm. What are the lessons from Senegal for some of the other countries in this Francophone West African sub-region who form the Ouagadougou Partnership?
First of all, I think that before giving lesson, we need to know exactly what happened in these countries. But I have discussed with Madame C, who is leading this Ouagadougou Partnership, and her problem is that she sometimes don't have the support of the leaders at governmental, sometimes ministers of health who are not convinced that they need to work on family planning. So these are possibilities for us to speak with our counterparts, discuss with them, give them the example of Senegal, how we have done it, maybe know more why they are not pushing this agenda, showing them what has happened in Senegal since we are pushing this agenda, this type of things. So this exchange can be the way, but we cannot impose to anybody anything because the ownership of country is first, and they have themselves to take their own decision. But by comparing, by trying to share experiences, I see that this is the way.
Well, Madam Minister, it is a pleasure and an honor to have you here. Your leadership has been exemplary, and your passion that you have exhibited here on the issue of family planning for the health and development of your country is something that we will take away and all of us will be working on for a long time to come. So thank you so much for joining us.
You're welcome. Thank you.